Good afternoon, everyone. I am Varsha Shrivastava from Bladder Wellness Team. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today, we are here to talk about urinary incontinence. Urinary incontinence is an uncontrolled, involuntary leakage of urine. The condition is common and distressing and may have a huge impact in the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of urinary incontinence, today we have with us Dr. Shashank Dhanuka sir. It gives me an immense pleasure to introduce Dr. Shashank Dhanuka sir to you all. Dr. Shashank Dhanuka is Senior Consultant Urologist at Royal Blackburn Hospital, Kolkata. Sir has a rich experience of 11 years in the field of urology and he has worked in India and UK. He carries out the treatments with utmost precision and efficiency, making sure that the patient's health are in safe hands. Sir, we are pleased to have you over here with us. We welcome you in our show. There are many things that our
Very good
viewers would
afternoon.
like to know. Yes, sir. So the
Yes, very
first
good
question
afternoon to you
is,
too.
Haji. So the first question is, what is urinary incontinence?
So very good afternoon to everyone, and thank you for having me on this platform. I'll just make a small correction. The Royal Blackburn Hospital was in the UK where I was working before this, and presently I'm working at the Medica Super Specialty Hospital in Kolkata. So coming to what is urinary incontinence. Now, this is a very less discussed problem that patients don't like discussing with their family members, with their friends, and they're usually ashamed of. So basically, urinary incontinence is the involuntary leakage of urine when a patient is passing urine at a time when they're not supposed to pass urine. It basically happens due to a loss of control over the bladder or a weakening of the control over the continence mechanism. So urinary incontinence is a passage of urine, even if a few drops are passing, at a time when the patient is not supposed to pass urine.
Okay. So, sir, what are the main causes behind urinary incontinence? Why does it mainly happens?
Right. So urinary incontinence, first of all, can happen without any cause at all. When it is completely idiopathic. I would classify urinary incontinence into its subtypes, and then it will be easier to understand why it happens. So there's a subtype called urge incontinence, where a person gets an urgent desire to pass urine. And when they're not able to locate a toilet nearby, or when they're not in a position to pass urine in a toilet, they may end up leaking a few drops of urine. So that is urge incontinence. That is the first and more common type of incontinence. And it can be associated with a lot of different underlying diseases. The most common among them might be overactive bladder or OAB. The second large group of incontinence is when a person is leaking urine, when their abdominal muscles are contracting or when there's a rise in the abdominal pressure. This can happen when they're lifting heavy weights. This can happen when a lady is sneezing or coughing. This can even happen when people are laughing out loud. So this is known as stress incontinence. These two are the major groups of incontinence. The stress incontinence happens because of weakening of the pelvic floor muscles, one of their components being the sphincter mechanism, which holds the urine when a person does not want to pass urine. So stress incontinence and urge incontinence can exist together. A person can have a combination of both of these, and sometimes the urge component may be more dominant, and sometimes the stress component may be more dominant. So together they are known as mixed incontinence. In addition to these three groups, there's another group where a person is in retention of urine. They're not able to pass urine properly because of some form of obstruction to the bladder, but still they leak a few drops of urine every now and then. This fourth category is known as overflow incontinence. This can be seen in people with enlarged prostates. This can be seen in people with stricture disease of the urethra, where the water pipe is having a certain kind of narrowing. So basically an obstructed system where the bladder is completely full all the time, and they keep leaking drops of urine now and then. So that's overflow incontinence. So basically, these are the 4 headings under which you can understand incontinence with their causes.
Okay. Sir, who are more prone to this disease? Male, female, or old age people? Who are more prone to this?
Right. So as you can understand, there's no gender bias to who are more prone to incontinence, but there are certain groups of people who are more prone to incontinence. Uh, Old age is one of the reasons when stress incontinence can manifest both in men and women. More in women because of the weakening of the pelvic floor muscles. In multiparous women who've had multiple childbirths, normal deliveries, where the pelvic floor muscles get weakened due to certain complications during labor. These women are more prone to incontinence. A lot of young people with overactive bladders, irrespective of any other problems, both male and female, can have urge incontinence. So there is no specific age group or gender group where this is more prominent, but it can be seen across different age groups, across both the genders as well. In elderly males with enlarged prostates, they have urge incontinence very commonly. One of the common presenting features is urge incontinence in elderly males with large prostates. So all of these people, even during a urinary infection in a man or a woman, can present with symptoms of incontinence.
Okay. So just now you have mentioned about prostate. So could you please throw some light on what is prostate actually?
Yes. So prostate is an organ. It's a gland located at the base of the bladder in men. This gland is, the function of this gland is to produce the fluid part of the semen. So the sperms are produced in the testicles, and the fluid part of it is contributed by various other glands, prostate being the most important one. It's a nature of the prostate to get enlarged in size in men with advancing age. So in men above the age of 50 years, it's a natural phenomenon for the prostate to become larger. Now, because of its location at the base of the bladder, it causes an obstruction to the flow of urine because it constricts the water pipe which passes through it. Now, this is one group of patients who may sometimes present with symptoms of urge incontinence.
Okay, so if somebody is having prostate, so obviously the urinary cycle will be disturbed, obviously, and they may
Yes,
have overactive bladder.
yes.
Okay, okay, sir. So what are the food items which are like directly or indirectly linked or may cause overactive bladder?
Right. Overactive bladder is one of the common causes of this urge incontinence symptom. And overactive bladder classically is associated with certain kinds of food, especially the beverages. So sodas, alcohol, tea, and coffee. Very commonly consumed, but these are known to irritate the bladder and provoke overactivity in the bladder. In addition to these, spicy foods have also been linked to uh, worsening the features of overactive bladder.
Okay, even spicy food as well. Okay,
Yes,
so obviously we must not eat spicy food or even the junk food. We must have a
yes,
proper diet. That is there. Yes, of course.
yes.
So does smoking or drinking alcohol has anything to do with it?
Yes. So alcohol, in 2 ways, it can worsen overactive bladder. Number one, it itself is known to be irritant to the bladder. And secondly, most of the alcohols have a diuretic effect. They increase the urine production. So they worsen the symptoms of overactivity because of the increased production of urine when a person would need to rush to the toilet every now and then. And they may also present with an incontinence-like picture. With regards to smoking, yes, smoking is also a provocative factor for overactive bladder because the active element nicotine and because of the cholinergic effects of nicotine, of smoking per se, it causes excessive stimulation of the nerve ends in the bladder, and they can also provoke overactivity in the bladder.
Okay, so this drinking and smoking is directly linked with it. Okay.
Yes.
Sir, how we can know what are the symptoms that will help us identify that we have got overactive bladder?
Right. A person needs to look at their cycle of urination and they have to realize how many times during the day they are going to pass urine. So rule of the thumb is if you are going once every 2 hours, it is fine. Anything more than 2 hours is completely fine. But if you're going more often than that, anything less than 2 hours, then probably you're passing too much urine. Now you have to look at the intake of fluids along with the timing of the urination. So if a person is consuming excessive amounts of water or is consuming diuretic substances like coffee or alcohol, then their frequency of urination is going to increase in proportion to their intake. But otherwise, in a daily routine with a normal diet, normal water intake, urination more than every 2 hours is considered to be a frequency. We call it frequency. So basically, that's an increased frequency of urination, one of the most important characters of overactivity of bladder. Another thing is the amount of urine that they're passing. Sometimes the patient can have an idea about whether they are passing urine in small amounts and going every now and then, or whether they are passing nearly 400 to 500 mLs of urine, which is the capacity of a normal adult bladder. So if they're passing smaller amounts of urine and going every now and then, they should be conscious that they might be suffering from overactive bladder.
Okay. So all these early symptoms we must not ignore at all. Okay, sir.
Absolutely.
So does medication really help, or it is only solved through surgeries?
Right. So the treatment of overactivity of bladder, although we are talking about incontinence, but incontinence, a major component of incontinence happens to the overactivity of the bladder. So the treatment of overactive bladder is a multi-modality treatment. There are a lot of things, a lot of components to it. I'll just summarize some of the salient components of the treatment. Number one being behavioral therapy. Behavioral therapy can include their food and diet lifestyle, in terms of their water intake, in terms of what kinds of food they're eating, in terms of how much fluid they're consuming. And the second component of the behavioral changes would be the bladder training. So these people can be trained, they can train their minds to pass urine at certain intervals of time, which is called timed voiding. So they should not just rush to the toilet at the very first urge. They should hold back. They should time themselves and try to hold for 2 hours and go only after 2 hours. The other thing is they can maintain a bladder diary, which is one of our diagnostic tools, where the patient inputs the fluid intake and also inputs the amount of urine being passed and the number of times along with the time when the patient is passing urine. They also make a note of any incontinence episodes when they might have leaked a few drops of urine. So if a bladder diary is maintained for 3 days, in addition to us being getting a lot of information about the patient's bladder cycle, the patient themselves can reflect upon their bladder diary, and they can, adjust their fluid intake. They can adjust the activities which were causing a lot of urination or which were causing the leaks. So this is the behavioral therapy component of the treatment. Coming to drugs and surgery. So there are a lot of drugs which can be used to treat overactive bladder, and there are various classes of medicines, and they have been found to be very effective in the treatment. We usually individualize the medications according to the patient's symptoms, according to the patient's other conditions. Surgery is very rarely required in overactive bladder, but you have to look at the cause of the overactive bladder. If it is an enlarged prostate in an elderly male, definitely surgery is going to help when you relieve the obstruction. Or if it's a stricture of the urethra, a narrowing in the water pipe, a surgery may help to reduce the symptoms of overactive bladder. Overactive bladder per se is usually not treated with surgery. There are two modalities which are there in the market and which have shown some benefit. One of them is the botulinum toxin, or the Botox, which is used elsewhere in a lot of medical applications. So we do an endoscopic examination of the bladder using a cystoscope, which is basically an endoscope to look into the bladder. And we inject the Botox into the muscle of the urinary bladder. So this prevents the excessive excitation of the bladder muscle and gives relief from the symptoms. Another advanced modality, which is very difficult to find in India, I have seen it being used in various other countries during my training and during my fellowships, is sacral neuromodulation. So this is basically like a pacemaker being installed into the heart. People have heard about pacemakers being put into the heart. This is like a pacemaker for the bladder. It's a neurotransmitter device which is connected to the nerves which control the bladder. So it is implanted in the lower back, by making a small incision. It's a small disc-like device, and it's got a battery and it's got electrical impulses in it. So it is connected to the nerve bundles which are supplying the bladder, and it will act as a pacemaker for the bladder. So it will control the contractions of the bladder. It will not allow the bladder to contract excessively. It will not allow the bladder to have an overactivity. And this has been used in advanced cases of overactive bladder where all other therapies have failed. So these two are the surgical modalities. And obviously you have the surgical options for the other diseases which are causing OAB. But to a great extent, a large majority of the patients are treated with behavioral changes, as I said, and certain medications.
Okay. So, sir, what is the success rate of these surgeries?
So surgeries are usually used in very, very refractory cases, as I said, which have not responded to medications, which have not responded to behavioral therapies. With regards to botulinum toxin, the response is more than 70% in most of the patients. But one problem with it is it's a short-lived response. It's not a permanent cure. You are looking at maybe, say, 6 months of cure, and then the patient may need additional injections. With sacral neuromodulation, the data is still limited because it is available in only a few countries across the world. But the results have been in the tune of 60 to 70% in a lot of patients with sacral neuromodulation. The life of the neurotransmitter is longer, so anything between 5 to 10 years, before which they may need the transmitter to be replaced. So that is what you're looking at.
Okay, sir. Now let's take some questions from our viewers. This
Sure.
is the question by Muhammad Shahrukh, and he's asking, are there any special instructions one should follow while undergoing the treatment for OAB?
Yes. So a urologist would first do a thorough evaluation of the patient for why they have presented, if we are talking about overactive bladder. And depending on the cause of the overactive bladder, the urologist is going to advise regarding the fluid intake. So drinking too much fluids is not advisable for patients with overactive bladder. On the other hand, as we live in a hot and humid country like India, a person should not get dehydrated as well. So something around 2 to 2.5 liters of water is sufficient for a person who is having an overactive bladder. The easiest way to know how much water is sufficient for you is to look at the color of your urine. This is applicable to everyone. If your urine is getting high colored, a yellow or a darker color, you are not taking enough fluids. The urine is supposed to be light straw colored, and that's where you know that your hydration level is fine. The rule of the thumb is about 8 to 10 glasses of water, which is 2 to 2.5 liters per day. The second thing is the consumption of irritant fluids, as we talked about earlier, like tea, coffee, alcohol. So they have to be consumed in moderation. If they can be totally avoided, it is best because they worsen the symptoms of overactivity of the bladder.
Okay. So very good tip we have got over here, that even we can check whether we are taking proper fluid or not. That is, check the color of your urine. Then you can know that if you are dehydrated or not. That's really
Yes.
good, sir. Taking the next question, and this already we have covered, but still we will just discuss it once again. This is the question by Muhammad Rafiq, and he's asking, what might be causing overactive bladder?
Right. So if you go into the reason behind the causation of overactive bladder, it's basically the nerves that supply the bladder. I'll tell you, the bladder muscle is just like any other muscle in the body. It is controlled by a set of nerve fibers. Now, there are two phases, a storage phase and a voiding phase. A storage phase is when the bladder is storing urine, and 99% of the time, your bladder is supposed to be in a storage phase, because drop by drop, urine keeps getting produced in the kidneys. They come down through the narrow pipes called ureters and keep accumulating in the bladder. So the bladder is 99% of the time during a 24-hour period in the storage phase. When the bladder is nearly full, a person gets the desire to pass urine. Two important things happen at that time. Number one is the contraction of the bladder muscle, the detrusor muscle, which will help to expel this urine, and the relaxation of the sphincter muscle, which is guarding the bladder. The sphincter is closed all the time. It is guarding the bladder. It is not allowing the urine to come out. It is also controlled by a set of nerves. So when a person goes to pass urine voluntarily, he or she relaxes the sphincter muscles, and the detrusor muscle gets contracted on its own without trying. So this is a very sophisticated mechanism of the nerve fibers controlling the two things together. When something messes with this mechanism, if the detrusor is contracting even without the bladder being full, or if the sphincter is getting relaxed even without the patient wanting to do that, this is when an overactive bladder will happen and when the patient will leak a few drops of urine.
Oh, okay, sir. Taking up the next question, and it is by Amitesh Tiwari. He's asking, how much chances of overactive bladder are there in youngsters between the age of 20 to 30?
Right. So in 20 to 30 age group, overactive bladder still can be present, although it is more seen in elderly people. But in young people, an idiopathic type of overactive bladder, as I said, without any underlying cause, without enlarged prostate, without a history of multiple deliveries, without any other cause. So overactive bladder can happen without any obvious cause in young people. I would like to add that the current lifestyle of youngsters, which includes a lot of abuse of coffee or tea or smoking or even alcohol consumption, that can be a predisposing factor for an OAB in young people. And the best way to get around this is to lead a healthy lifestyle, to exercise, to keep your muscles of the pelvic floor strong, to consume as less as you can of these irritant fluids like tea, coffee, and alcohol.
Okay, okay. So from this itself, I've come with the next question, that you were talking about the treatment, other than medication and of course surgery. What things we should adapt in our lifestyle that will help us to get rid of this overactive bladder?
Right. So the first point, as I already said, the diet of the patient. Too much of oily and spicy foods, alcohol, tea, coffee, we've already talked about that. The other thing is the water intake, which, as I mentioned, if you're having a tendency towards OAB, try to restrict your water intake to around 2.5 liters. Again, take a look at the color of your urine. If the whole day you're spending out in the sun and sweating a lot of fluid out of your body, then you might need a little more, but then your urine color is going to tell you whether you are dehydrated or not. The third thing is time voiding. This is one very important thing. If a person is getting a mild urgency to pass urine every half an hour, they should try to restrict and not go to pass urine and look at the clock and time themselves, and at least try to keep the intervals to 2 hours between subsequent voids. So these are behavioral changes, exercise, an active lifestyle, relaxation from stress. All of these are also things, apart from medications, that help to control overactivity of the bladder.
Okay, so we can also identify and help, okay, ourselves. But still, one thing that we all the viewers need to keep in their mind, that please consult a urologist when you see any early symptoms. That is something you must do. Okay, sir, how much time or how much duration does it take to treat overactive bladder?
So this is also very subjective to the patient, depending upon how severe the symptoms are and what are the underlying causes for the overactivity of the bladder in these patients. But usually 3 to 4 months is a good time when they get a good response. At least they have a 60 to 70% response based on various therapies. And then that response can be sustained over a long period of time.
Okay, okay. So it takes 2 to 3 months. That's quite a long period, but the best thing is it is treatable. Okay.
Yes.
So this next question is by Shalini Rai. She's asking, if my uncle's OAB gets better, should he stop taking the medication or he should continue with it?
So if the person has taken medicines and that has improved his or her OAB, they can try to stop the medication and observe their symptoms over a period of time. Sometimes the patient may get better and may be able to be completely free of OAB even without the medicines. But it has been seen very often that the patients need to take the medicines on a long-term basis. but they can give it a try. They can stop it for a couple of days or maybe 4 to 5 days and see if their symptoms are worsening. They can always review with the urologist. Sometimes the dose of the medication can be changed. Sometimes the type of medication can be changed. So those things can be done. But there's no absolute cutoff that, 3 months of, it's not like a course of medicine that you take for 3 months and then you stop it and everything is fine. It's not 100% cure that we are looking at. It's a treatment to make their quality of life better.
That is there. And obviously, whenever you feel like stopping it, first and foremost, you need to consult a urologist. Then only you can stop taking any medication. Okay.
Yes.
Sir, when we take a medication for a longer period of time, or even when we take a medication, so it does has a side effect. So
Yes.
the same case with OAV?
Yes, it is. So we have a lot of research going on with the treatment of overactivity of bladder. And the current accepted or validated medicines, most of them are pretty safe to use, but they do have their side effects. A certain class of medicines, which is very commonly prescribed, can cause a lot of dry mouth in the patient and can cause a little bit of constipation. There's another increase the blood pressure. So usually your urologist is going to give you a warning about the side effects, but at the dose at which it is prescribed, usually those side effects are tolerable, and most patients do fine with these medicines.
Okay. So it does has a side effect, but obviously you can take care of yourself or your
Yes.
health, then you can cure it. Okay, of
Yes.
course. So sir, this is a myth that generally viewers has or many people have that when we drink more water, so obviously we feel the urge to urine more.
Yes.
So and if we just cut down the amount of water, so it will really help us. So what do you want to say about it?
So, as I said, if a person is cutting down their water intake because of overactivity, say a person is having a lot of symptoms of overactivity and they start cutting down their water intake, as long as they are around the 2 to 2.5 liter mark, as long as their urine color is fine, they're all right. So previously, if they were taking a lot of water, say around 4 to 4.5 liters, and now they've cut it down to 2 to 2.5 liters, they're fine. That's a valid strategy to deal with OAB. But if somebody is consuming, say, 800 ml of water in the whole day, or say 600 ml of water in the whole day, they're literally not drinking water from the fear that they'll have to run to the toilet every now and then. That's a wrong strategy. They have to consume 2 liters and they have to consult a urologist. They have to maintain a bladder diary and they have to take medications so that their body functions, which need around 2 liters of water, are also being fulfilled and the symptoms are also under control. So you can't treat your OAB by taking 500 mils of water and then causing damage to other parts of your body, because water is a very important component of your diet during the whole day. So 2 to 2.5 liters is a very important number around which a person is fine. If they go below that, probably not a good idea.
So at no point you can cut down the amount of water intake that is really, really needed for you.
Yes.
Okay. Yes. Taking the next question, sir, and that's by Manoharan. And he is asking a very relatable question over here because COVID time or coronavirus has really impacted our lives in a very bad manner, actually. So how does it impact the life of a person who is going through overactive bladder?
See, there are so many things that come to mind when we talk about this coronavirus and the pandemic and the lockdowns all across the country. So if I talk about the causation of OAB, a lot of activity has gone down in people. They've become more and more sedentary. They're only looking at their laptops.
Okay, sir.
They are they are only they are only looking at their laptops and mobile phones all the time. They are sitting in one place. So an active lifestyle mobility, this has been compromised, number one. Number two, if they have symptoms, they are very afraid of going to the clinic because they are worried about exposure to coronavirus. Now, there are various ways to manage this. One of them can be consulting online, because overactive bladder, although physical examination is a part of how we assess a patient, but there are at least a lot of treatments can be started just by consulting a urologist online and telling them about their symptoms and sharing a bladder diary online. So a lot of stuff can be done online and they can start their treatments. The urologist can give a lot of diet advice, lifestyle advice to the patients online. So during COVID times,
Mm. Okay, sir. Sir, please continue.
various ways there are various ways in which you
Mm.
can keep an active lifestyle. Even in spite of the lockdown, people can work out at home, people can do yoga, people can walk at their terrace. So, active lifestyle, diet control, and consulting a urologist online if
Mm.
you're afraid of going to the clinic.
Yes. Even online consultation is also available,
Yes.
so we don't have to worry about the health. Must consult a urologist whenever you're feeling any kind of symptoms.
And
Okay.
listening to, I'll just put in one more thing, and listening to these kind of webinars organized by the Bladder Wellness, Bladder Health team, which is for
Yes.
the patients.
That will also really help, and that is helping many of our viewers as well, sir. Okay.
Yes.
Sir, are children also prone to this disease or they are safe?
The incidence in children is very small. It's very rare in children.
Hmm.
Most of the times, if children are going to the toilet very often, it is usually a behavioral problem. A very small number of children may suffer from OAB, but the percentage is very small. And very often, it's a behavioral thing which can be treated by behavioral modifications.
Okay. So it's a behavioral problem, and the children are not that much prone to OAB.
Yes,
Okay, fine.
less common.
Okay, they are less. Okay, fine. Sir, what are the myths related with OAB? The myths that you would like to bust?
So, first of all, a lot of people are not aware of OAB.
Hmm.
They just say that they don't even know that an entity like OAB exists. They just think that they have lost control over their bladder and they are just needing to go to the toilet every few minutes, and their life is miserable because of that. This affects a lot of daily life. It causes a lot of stress. It even affects relationships between people because they keep running to the toilet. It affects professional life. It affects travel. People are fearful of traveling in buses or places where they don't have access to a toilet. So basically, we need to make people more aware that there's a condition called overactive bladder. A lot of research has been done on it, and there are a lot of treatment options for this condition, and they can make their life much better. Even if it is not 100% cured, there is a good degree of treatment available for this. So they can have a good quality of life in spite of suffering from OAB.
Okay. So all these things we need to keep in our mind. Now taking the next question, and it's by Vignesh. Though this one we have already covered in the discussion, but once again I would like to take this question, sir. How long old patients need to take medication if they are going through OAB?
Right. So as I said earlier, sometimes a patient may need to take the medications lifelong. But this is an ongoing thing. So you have to check every few months and you can stop the medications and see how the symptoms are. Sometimes the dose can be reduced, sometimes it can be stopped completely.
Hmm. Okay, but lifelong. Okay. Whenever you have been prescribed to take the medication, keep on taking it until unless your urologist is telling you to stop.
Yes,
Okay. Next question is by Varun Jain. He's asking, does dehydration cause incontinence?
not really. Dehydration would not cause incontinence. It will cause a lot of other problems because of water deficiency in the body. A lot of other organs are going to malfunction. Even the kidneys are going to have trouble. But
Hmm.
in general, dehydration is not a common cause of incontinence. Overhydration can be a cause of incontinence.
Yes. Okay. So taking up the next question, and it is by Niranjan Reddy. He's asking if we are having 4 to 5 cups of coffee daily, will this cause OAB?
So this is the kind of question that my patients in the UK used to ask me. They used to have like 6 to 8 cups of coffee during the whole day. The weather used to be really cold, and they're just sipping coffee throughout the day. Yes, coffee is known to be irritant to the bladder, and 4 to 5 cups is a high quantity. We usually advise the patients to restrict to 1 to 2 cups during the entire day. This is especially for those who are prone to OAB. It is not for everybody, but if a person is suffering from OAB, if a person has already got symptoms of OAB, they should not be consuming 4 to 5 cups in a day. They should restrict to 1 to 2 cups.
Okay, because caffeine causes OAB. Okay.
Yes, it stimulates the bladder.
What about the intake of tea? Because we Indians, we drink tea more.
Yes. So tea also is has a similar effect, although the potency of theophylline, which is present in tea, is less than caffeine, which is present in coffee. But tea is also known to be irritant. And I'll tell you, in India, we drink a very strong coffee, a very strong tea.
Yes.
In the Western world, people have very mild tea. Usually, they use a dipping bag, tea bag, into a hot water cup, and they drink very mild tea. But we have the Indian culture is for boiling the tea with a lot of tea leaves and making it as strong as possible. So tea is also a bad idea if taken in a high quantity. I would restrict it to 1 to 2 cups of tea in the whole day if a person is suffering from OAB.
Okay. So whether it is tea or whether it is coffee, you don't have to take it in a large amount. That you need to keep in
Yes,
your mind,
yes.
of course. Okay. So this one also we have covered in the discussion, but Saurav Manna is asking it. So sir, I would like to ask this question. Sir, please suggest a diet for avoiding OAB.
Very simple. Spicy and oily foods, which are bad for your tummy, which are bad for your heart, are also bad for your bladder. So avoid lots of spicy and oily food. Most of the junk available in the market is spicy and oily. There's a good reason why they're called junk.
That is there. And nowadays we are like more interested in eating the junk food or the we eat spicy food a lot. So that is something that is to be avoided.
Yes.
Okay, in order to have a healthy lifestyle. Okay, sir. Sir, in the end, is there any advice you would like to give to all our viewers regarding OAB?
Yes. So the general advice for everyone would be, first of all, make yourselves aware that there's a condition like this, because awareness itself is half the battle won. You should be aware, you should be listening to talks like these from various platforms, make yourself aware of it. Number two, the age-old advice given by the previous generations regarding an active lifestyle, regarding working out, exercising, doing yoga, eating healthy food, avoiding too much of spicy and oily food. Follow this advice. There are so many benefits of following this advice. Each of us must follow this advice. Number three, if you have symptoms of incontinence or symptoms of OAB, uh, try to find out more about your symptoms. Try to be more conscious about your symptoms and consult a urologist as soon as you can. Detect early, treat early is the principle that I like to follow. If you detect early, if you treat early, you can have a better quality of life. There's no point suffering with overactive bladder by being ashamed of sharing with friends or family. There's no point being, suffering from these symptoms when so many treatment options are available. So try to reach out to a specialist, talk to a urologist, and start your treatment. Follow the behavioral therapy, follow the lifestyle advice, and end of the day, it's a better quality of life that both you yourself and your urologist want for you.
That is there. When you get to know the symptoms at an early age, you must go and consult a urologist. That is one thing you need to do.
Yes.
So it was really an informative session, sir, for all our viewers. Many myths are also been busted regarding urinary incontinence. I hope all these things, all these points we will keep in our mind and
Yes.
will lead a healthy lifestyle. Okay, sir. Thank you so much for your valuable time. And this is a very informative session for all our viewers. Thank you so much, sir. And thanks to all our viewers for being so patient and asking lots and lots of questions to us. You can follow us on our FB page, that is Bladder Wellness. We are available over there. And you can follow us on Instagram, Twitter, and YouTube. And see you soon in the next session. So take care, everyone. Have a good day. Thank you so much, sir, once again.
Thank you very much. My pleasure.